Okay. Welcome back. I hope you're all full now. I said before the break that we would have, if you have some leftover questions that you would like to ask Erica about the presentation or any of the numbers, we can do that. And we'll start out with that, questions from the audience, and then we'll go to our panels, and Shirley Senarigi will be introducing our panel then. Okay. Shirley has a microphone, so you can.
Question, please wait for the microphone, or you will not be picked up by the camera.
Oh, okay. My question, Erica, is I did see you had wisdom up there, but how have you interacted with some of the local congregations? For Door County, a lot of social justice work is done through the congregations here.
Well, in Dane County, a lot of our work is through faith-based communities, just having conversations, and in many instances, congregations coming together to promote the conversation around social justice and racial equity. There are a lot of folks, in particularly Black-led churches, who are promoting policies and changes in the community through that. So we spent a lot of time trying to sort of touch base and have discussions, because in Dane County, as well as probably like you said here, there's a lot of movement and momentum that comes out of the faith community. And has historically been the case, right, for a lot of social justice movement. So we just have being available to have conversations and to amplify and be a value added to what they're working on and what movement they want to focus on. So that's how we've sort of integrated that into our work and our community engagement. And wisdom with respect to the criminal justice system. I mean, this a data point, and a really critical issue for the state of Wisconsin. We have the highest rate of incarceration of African American males in the nation, which makes us the highest almost in the world, because we as a nation incarcerate more people than anywhere else in the world. So,
other questions at this time? Well, maybe there'll be more later. Oh, one here. I'm sorry. Here you go.
Yeah, I was mentioning to Erica during the break that we just had a series of events in October promoted by Focus on Fairness called Opening the Door on Economic Inequality. And Dylan Fitz came to speak. Some of you may have come to those events, and Chuck Collins also came to speak. But my concern is that all these programs sound wonderful, and you're getting people out to vote thinking about what you want to accomplish with your vote, who's going to represent you in terms of your personal view of these programs' worthiness. I'm finding voters very hard-pressed to say, yes, I will pay more taxes for supporting these programs, or I will do more, I will give more, when there's such wealth and income inequality overall, with the top tax breaks and income advantages going to the top 1/10 of 1%, and the middle class almost disappearing in this country, in this state. It's just declining constantly, and always asking the middle class to do more. So I'm hoping you will become aware of that and begin to touch on that in your talks about, just income and wealth disparity overall, not just with people of color. And I would like to point out that there's a handout. If you didn't get to come to those talks by Dylan Fitz and Chuck Collins, you can look at them on video. The video sites are listed on the front of this page, and the handout of reading list and everything is over on the side table there for you to pick up. So anybody want to address that? If you want to address that.
I have a few thoughts.
That's fine.
I think one of them is that, we have to have a more equitable tax system where we're taxing more equitably across the board, right? So that those with less are not paying the bulk of the services that are needed. I also think that when you have people in systems and circumstances, I agree with you completely, and that there's a growing economic and wealth gap regardless. But I also think that we have to sort of reframe our thinking about what it means to have a reform. A lot of it has to do with different people doing their work differently, with a different lens, and it doesn't necessarily cost us hundreds of millions of dollars more. It's about going about the day-to-day different. It is a lot about talking to each other in other places. I also think that we have this we've kind of gotten ourselves into between a rock and a hard place, because our conversation is always about like government or the nonprofit sector, right? And those folks taking care of the circumstances. And government has been shrinking, right? And so we ask that funders in the nonprofit sector, and they pick up all the slack on these circumstances, and we rarely challenge the private sector. And at some point, not paying living wages, there's no buying power if people aren't there for the private sector. And they're responsible for creating a culture of these jobs with living wages, et cetera. And I think that constantly doing the back and forth between government and nonprofit and who's responsible, we leave a whole portion of the conversation about how to change our economy out. And I do think that while we need all these things are available to us. If we think differently, if we think together, if we think collaboratively, if we, like I said, de-silo and not make excuses all the time. Well, it wasn't my fault. It turns out it was Human Services' fault. So don't give me any, don't blame me. I don't want to take any risk. That's how it always goes. I think that's one of the things that's really interesting is that there's always a scapegoat, and the scapegoat should be your team member, right? And if people said, you know what, yeah, I got a lot of work to do in my arena, and I'm going to do it, and you got a lot of work in yours, then it's a totally different dynamic that's taking place. So I agree that we have to address, with different tax policy and the growing wealth divide, we also have to think about how we relate and think about the systems too. And then with respect to, the notion that my liberation is tied up in your liberation is really key for the economic thinking too, because my future wealth and security is tied up both in the folks of color as well as in my white neighbors or whatever. So those are my thoughts.
Thank you. Yes, let me bring you the mic.
Hi. Okay, this is a little bit of preaching to the choir, I think, that we're pretty much all on the same page. And I've just finished reading Ta-Nehisi Coates' 8 years. We were 8 years in power, and I forgot the name of the other one. But anyway, I've seen these statistics, and I believe them. But I know people that would tell you, that they don't. How do you reach? How can you, how do we reach that part of the public that doesn't necessarily believe this ugliness?
I don't know. I think that's really like one of the really fundamental questions of the hour, and I grapple with it because lots of people are saying that, right? And then we just need to listen and talk to each other, but everybody's very much sort of like grounded in their space. And depending on the day or the hour, I can answer the question differently. So I think on the one hand, you're right, having conversations. Like, okay, forget it. If you're not going to believe the facts, then try to believe someone's actual experience, like their qualitative experience about how they've experienced life as this particular person in this particular identity. And maybe there will be some shared value there. Maybe there's some shared space. I think one of the things, is about shared values. Like, what are some of the most fundamental things that we share as a community, as a state, that we can sort of tap into and then go from there? And I think that our differences aren't actually that different, right? I fundamentally believe that as like an optimist, and then there's other days and I'm like, forget it all. Forget the people that aren't listening to me. I think there's enough of the choir. If the choir were just to like agree on a time and a date, like there's enough of a choir to like go forward without. So it's really, and I think we sort of need, depending on the issue or the time or the circumstance, either pick up either one of those, because I think different tactics will advance it. And I think there is, it is a fight, because even if, this data itself as facts is at risk with the census and the the undercount of the census and the underfunding of the census, like we're not going to have the same ability to get the potentially the same information for our communities to get the same federal funding in the new 2020, so there are a lot of things that are at stake, and I think until we have to do both. I think really we have to do both. Figure out what our shared values are, find people outside the choir, and then sometimes just go in and insulate yourself with the choir a little bit to reinvigorate, right? And then go back out. So I don't really know the answer. I wish I did, actually. So anyone else over here?
I'd like to throw in my 2 cents. I think a lot of it happens one-to-one. I feel like people hear your strong opinions and feelings and facts in one-to-one conversations a little more openly than when they're in a large group, because defenses come up and they tend to take sides in a larger group. So I'd encourage us all to hang in there with our one-to-one conversations, as well as support of organizations and groups.
Oh, that reminds me, can I add 1 second?
Oh, yeah.
That I think we're also fearful of something, and maybe if we identified what the fear was about the space, I think that these conversations trigger a defensiveness that is grounded in fear, and I think how we get at changing the conversation or changing our language or changing how we talk about it so that we sort of have that sort of underlying thing where we're sort of dispelling like, I'm not against you, like I'm with you. And then that goes back to the shared values. And in those one-on-one conversations, sometimes I had the opposite experience. Like the group is better than the one-on-one because like I buckle down harder sometimes. So I don't know. I mean, it's really about thinking about that and finding those different spaces and that different language, too.
I moved here to Door County about 20 years ago, and I came from Detroit. I did not grow up in Detroit. I grew up in a small town in the northern part of Michigan. But I went to Detroit and worked for 20 years as a social worker. And I was teaching a course at a university, and it was not in the city of Detroit, it was in one of the white suburbs. But this particular university was very welcoming to black people. And so I was teaching a sociology class, and it was a Saturday seminar. We broke for lunch, and we were all supposed to be back in an hour. Everyone got back except the one black man who was attending the Saturday seminar. And so we waited, and we waited. Well, then we finally had to start going because he wasn't getting back. He got back an hour late because he had been stopped by the white police in the white suburb. They wanted to know what was he doing in that area. Now, all of the rest of us went and had lunch, had no problem. But driving while black in a white community, he got stopped. He was absolutely beside himself. It took us another hour to process that with him. So as you said, if you get to know some of these personal experiences that people go through, and you experience it then with them, I mean, you really have a much better understanding about what some people live with every day. Thank you.
Ann?
Hi. Thank you for being here. We see that by 2020 or whatever, the majority of people in the United States are going to be of color. I see ads in the paper for schools asking for people that know Spanish. We have the reading program with the children, but they're speaking English. It seems to me like we ought to be teaching Spanish in places like this, in the schools, not as an elective, but more I know in Head Start we did multilingual. And I'm also wondering about the medical and the social ramifications of these transient people that come for the growing seasons. That probably don't have citizenship, and now that's become such a huge fear that they probably won't even seek it. And thirdly, wouldn't a great group like the League of Women Voters, nonpartisan, run fact checks once a week on candidates' ads?
We'd be busy. I think Ann's comments are really a good lead-in to introducing the panel and what we have in regards to some organization response to working with people of color in Door County. So I think I'll introduce the panel, and then there will be additional time for more comments and questions to Erica or any of our panelists. We have 4 people here today who represent organizations within the county. There are many, many more who certainly deal with issues in our county, but we are starting with these 4. Joe Krebsbach is here, and he's the director of the Door County Department of Human Services. His background is in social work, his degrees from the UW Eau Claire system, and then he later got his master's degree in public administration. He's worked in the county for a number of years, started in AODA counseling, community mental health crisis services, but now is in a managerial role with the Department of Human Services. We also have Dr. Jim Heise with us. He's an internist and the chief medical officer at Door County Medical Center. He received his medical degree from the Medical College of Wisconsin, and he's been practicing here in Door County for 8 years. I think it'll be interesting. He'll have perspectives from work in previous communities as well as his experiences here in the county. Patti Vickman is a Southern Door girl. Patti is a graduate of Southern Door High School and returned to Door County several years ago to serve as that school district superintendent. Her goal was to give back to the community that she felt gave her a good education growing up. She's also married to Steve Vickman, who is the executive director of HELP of Door County, so has some knowledge of what's going on there as well. She's been in education for 40 years as a teacher, principal, central office administrator, and many other roles. Has worked in the county now for a number of years, but also brings to us today her experiences working in other school districts and communities with people in need. And lastly, we have Amy Kohnle here with us. Amy is attended the University of Wisconsin in Stevens Point, Northeast Wisconsin, Heritage. She has degrees in psychology and sociology and minor in interpersonal communication. She worked in the first AmeriCorps team in the nation. She was part of that initial group. Worked with Girl Scouts in the Wausau area, bringing the Scout activities to the Hmong population, but now has been the executive director of United Way of Door County, and in that role collaborates with many other organizations in the county. So what we've asked our panel to do is to talk a little bit about their agency, but also what challenges do they see here in Door County for people of color. Earlier, Erica said, you know, besides the data, you need to hear the stories. And these are some of the people who have kind of direct line to the stories of children, of people who need medical care, agencies that are working with people in our community. So what challenges do they see? How are their agencies addressing them? And what needs do they see? We'll start there, and then we'll open it up for more discussion. Joe?
Good morning, everybody. I'll start out by saying I was a little relieved when Erica presented her slide on Door County, because way back when Susie called me about this event, I said, I don't know what I can tell you. The population is so tiny for minorities in Door County that we serve almost none. I'll circle back to that in a minute, but let me just tell you a little bit about what Human Services does so you kind of have the scope of that. And a lot of the stuff that Erica talked about are things that happen within our department. And yes, we are responsible to fix most of the problems, or we're at fault if we're not fixing them. So juvenile justice and child welfare system is part of our department. Economic support, so qualifications for individuals who are low income for Badger Care and food share programs is through our department. We provide mental health services, psychiatric, AODA, mental health counseling. We provide lots of programs on the mental health side of things that are outside of the realm of what you would consider normal therapy, kind of case management type services. We also run the ADRC as a division of Department of Human Services, which is serving primarily our aging population, but also individuals with physical and intellectual disabilities. So we really have a gamut. We cover a lot of areas. And for the last 4 months, I've had opportunity to also provide some supervision and direction with the public health department. So I'm involved in a large array of things, which also means I don't know a lot about any of it, if that makes sense. As was indicated, I have been in the system here in Door County for a long time in a lot of different roles before I moved into the administrative role. So this morning I pulled up numbers. We have multiple systems, and with all of those programs, we have lots of different computer systems. And some I have access to and some I do not, mostly because I just wouldn't have time to get into them. But I have access to all of our mental health services that we provide through the county. And right now we have a little over 140 cases open. I'm sorry, 1,040 cases open in the county. And less than 20 of those are minorities. So it's about 1.7% of the folks that we're serving when I ran the numbers this morning. And I thought, wow, that's really low. And then I ran the numbers for the last 10 years, and it was pretty much consistent all the way through. One of the things that I would say, and this is probably more anecdotal than the numbers would bore out, because one of the things that Shirley asked about was, what are some of the challenges? I will tell you, back when I was doing AODA services, we had a larger Hispanic or Latino population coming in for services that we do not see coming in our doors anymore. And I believe that's because we're government, and that makes us scary. So in the AODA world, individuals were coming in and seeking services to try and help take a look at their alcohol or drug use. We do not have, I couldn't tell you the last time we had somebody come in voluntarily seeking services from that population. And again, the numbers that we serve are really tiny. We also didn't discuss what we were going to do here, so I don't want to monopolize a whole bunch of time, and I'm certainly welcome to take any kind of questions that you want. I did find it interesting, and again, in terms of some of the stuff that Erica talked about, that I believe we're doing well here in Door County. I'm not sure that it's helping with disparity issues because, again, if I look at that minority population, the majority of the people that we're serving are actually Native Americans. So that's the highest number of that under 20 group. We have, and part of me says, I almost can't identify, because the numbers are so small, we're talking about 1 or 2 people of other races, and by identifying those races, I almost feel like I'm identifying who's coming in. So that it's tiny. Most would be 1 or 2 individuals of different races. She talks a little bit about kind of changing the lens of how we look at things and how we do things. And so we're trying to do that in multiple ways. We have been, for the last 2 years, working on a trauma-informed care initiative. That's a different way of looking at people that come in our door. It's a different way of starting with, what are we looking at? And it's really about, tell me about your story and where you're coming from, and let me understand that, instead of, what's wrong with you and how can I fix it? And so we've been working on that community-wide. We initiated that through the county. We got a grant and we're able to run some of that through Human Services, but we're doing that in partnership with the schools, United Way, public health, lots of different areas where we're involved in trying to promote this different way of dealing with folks, regardless of who they are and regardless of why they came in our doors. We also are, again, I think, and again, at least from a disparity standpoint, I'm not sure that it's relevant, but we're looking at even changing the way we're looking at child welfare cases and juvenile justice cases. I don't want kids going to Lincoln Hills, ever. So we're trying to figure out different kinds of programs and different interventions. Next year in our budget, we put aside just short of $100,000 to create a day treatment program or a day service program. That's something, Door County had an alternative school program years ago, and that went away because of funding, but I'm looking at it saying it costs me almost that much to have 1 kid in Lincoln Hills. So if I can do something different, and we can do other earlier interventions, we're gonna try and do that. And we've been trying to move that direction for 10 years. I mean, when I say trying, we're taking steps. But we're always looking for new ways to kind of change the lens about how we're looking at programs and how we provide that to people. With that, I'll pass it on, and I'm welcome any questions that you might have.
Well, I too, I'm grateful to be here, and I was really fascinated by Erica's talk. What I will say is, I moved here a little over 8 years ago from the Milwaukee area. So, as many may recognize, Wisconsin's a very, unfortunately, racist state. Milwaukee probably is among the worst in that area. This became personal for me. I mean, my wife and I grew up in a predominantly white suburb, Menomonee Falls, and 11 years ago we were blessed to adopt our son Daniel. Daniel is Hispanic. He is from Guatemala. We brought him home to us when he was 9 months old, and so immediately it became personal from the perspective of what's that going to mean for him as he grows up? How is that going to affect how he proceeds through the world? When my wife and I thought about moving up here, when I was looking at the job at the hospital, that was one of our first thoughts is, boy, at least it's racially diverse in Milwaukee. Where are we moving to? And as Joe indicated, the numbers are almost not statistically significant from the standpoint of you look at the number of whites that we treat and the number of the rest. You really can't even make a judgment because the numbers are so small. So that's sort of the lens that I look at this through. at my role at the hospital, you know, I think your comment was very apt. There's a lot of conversation about disparities, and it's difficult for me because it's not just racial. It's everything. It's financial. It's the fact that we're in a rural area. I mean, there's a lot of things that account for disparities in healthcare. And I'm proud to work where I work and to do the work I do because I think we do a really good job of trying to treat every person that's around. And I say, you know, it's not just a patient, it's the person that's around. When it comes to illegals, I'll address that because that was brought up. You know, when you're a physician, I mean, we do not, it does not, what we see is someone that is in need of help, and whatever form that help takes. And that's what we do, I think. I think we do it well. I was speaking with our chief administrative officer about some of this, and he made the comment that they ran some numbers a while back, and a few years ago, the number of illegals was very high that came in. But we don't go checking, we don't care, it doesn't matter. But I can't help but think that there is a chilling effect, that people won't come in and seek care because, as Joe said, they're concerned. Even though we're not the government, we're still an institution that people, I'm assuming, would assume that, you know, could cause them problems. So what ends up happening is they end up getting sicker and sicker and sicker until they need to seek emergency care. And they'll come in at death's door, and that's what you don't want. You really don't. The other thing that we hear a lot is people say, well, you have to treat everybody. You're required to treat everybody. There's an act called EMTALA, which is the Emergency Medical Treatment and Active Labor Act that was passed in 1986. And that basically says that if you receive payment from Medicare, which is almost every hospital in the US, you must see patients, treat them, and stabilize them. You cannot transfer somebody based on ability to pay or any other criteria. People will say, well, there you go, that's free healthcare, they get it. That's not enough. EMTALA is just that, it's stabilization, and then you treat them from there. From our perspective, it doesn't matter, they come in the door, they treat, they stay at our hospital unless we're not able to provide that service. We are a small 25-bed critical access hospital. There are things that we simply can't treat. My role, by the way, taking a step back, Shirley said I'm an internist, I am. My clinical role is as a hospitalist. So if you meet me, if I'm taking care of you, you're sick. So it's irrelevant to me, your lot in life, your station in life, we need to take care of you as that person. So it's kind of a long, you know, I decided I was going to do this extemporaneously, and this is what you get when I'm extemporaneous, which is, you know, kind of all over the map. Again, I don't. Pat asked me too. What's your expertise on this panel? I said none whatsoever, other than just experiential. You know. As Joe said, we'll be open for questions when all of our remarks are done. So thank you for having us.
Okay. Well, I'm glad they talked about experience because I'm hoping that my experience growing up here in Southern Door in the 60s and 70s, and the journey that I've taken as an educator regarding this topic will be a little bit helpful. I grew up just south of Southern Door in a farming family with 6 children. We by no means were rich at all. In fact, maybe in some senses we were poor, but we never lacked for family, for faith, for food, and for great work ethic and things like that. It was when I moved to college, which I was able to accomplish because of scholarships, that my experience with diversity grew a little bit. I had one student in our high school who was of color, and it was, now looking back, that person was black. But it was easier for that person to say they were Native American at that time. So in my journeys, and with a husband who traveled with his job, at one point in our life we ended up in Louisville, Kentucky. Louisville is quite cosmopolitan, has lots of diversity, but it also has lots of color in its students. And I happened to work in a school teaching first grade where half of my class was black. And I really had no experience. And my first thing, as any new teacher would be, is I love all children the same and I want them to succeed. And it was in that setting that I probably really came to understand that equality is not equity, and really got to understand from personal experiences what children were going through. And also on the opposite end, and it may seem kind of strange, but when you come from Wisconsin and you go to Kentucky, you are a Yankee in some senses. This was back in the 80s, and there were a lot of implicit biases about who we were as individuals. After that, we moved to Oshkosh, where I spent 27 years, and that's probably where my greatest learning curve was in working with diversity. I ended up being an elementary principal for 17 years in a school that had 400 children, 70% poverty, and 14 different languages being spoken. We were the primary site for the Sudanese and Bosnian refugees. We had a significant Hmong population, and our Hispanic population was growing. There was a lot of movement of families from Milwaukee, Chicago, Racine, and Kenosha to Oshkosh because they felt it was a safer place for them to raise their children. And it was through lots of education with our staff that we needed to learn how to do things differently in order for our students to achieve. We kept our school open from early in the morning to late at night, and some of that was to address what Erica talked about as the two generations. Because childcare wasn't prevalent, just like we have the issue here. Having quality food wasn't there, so we had our breakfast program. We had an after-school program where 2/3 of the kids stayed after school until 6 o'clock, just to make sure that they had quality things that were happening. We had to completely change, and that's a challenge I see up here sometimes, that our print materials, our pictures, things that we showed represented the individuals we served. And everything from artwork to newsletters to things like that. So then, of course, coming back to Southern Door, I met with a staff who was experiencing some changing demographics from what they were used to. And again, in my experiences, just as Erica shared, it's not about two-parent families, and it's not about the education, and it's not about whether they go to preschool. It's a lot of factors that impact those students. And so it was interesting as I would work with some of our families of diversity who then moved to Door County either for jobs or because this was a safer place that they wanted to raise their children. How do they become involved? So I talked with my fellow superintendents in Door County, and we are experiencing the enrollment decline that rural schools are facing all over Wisconsin. And that the challenges we face as rural communities, providing the services that our students need, is a challenge. Our poverty levels have remained about the same at Gibraltar and Sevastopol since the recession. However, they have increased at Southern Door and Sturgeon Bay. So we're over 40%, and Sturgeon Bay is nearing 59%. And again, it's very difficult to separate where poverty begins, where it ends, who's involved with it. Our English as second language percentages, Gibraltar does have the highest amount, possibly due to the service industry up there. But Southern Door and Sturgeon Bay have doubled their numbers in the past 5 years. We added a half-time ESL teacher 2 years ago. Sturgeon Bay is looking at increasing theirs to full-time. There's very similar stats for the Hispanic because much of our ELL population is Hispanic, as we were talking about. Our Black population is minimal, but that doesn't mean that they aren't important. And I think sometimes the smaller the numbers, the easier it is to feel like you're left behind and you don't have that voice. So when you look at what are some of the needs that have been identified that our schools are addressing now that they didn't 5 years ago, with the emphasis on school report cards and schools being measured by their academic achievement, it is the achievement gaps that we see not only with our students of color, but also students of poverty. It is the mental health needs, which Joe already talked about. It's about students coming to school not ready to start school. So we have to change our mindset. How do we make our schools ready for children instead of expecting children to be ready for school? It's the lack of parenting involvement, not by will, sometimes by skill, but sometimes due to the fact that they're having to do 2 jobs. Our high school students, now some of them we know are working to support their habits, you know, of the cell phone and the car, but we have a number of students who are having to work to support themselves or their own family lifestyles. We try to recruit and retain high quality staff so that the skill set that our staff have can continue to move forward. But we also have experienced declines in state aids, which makes it very difficult for us to keep high quality staff when they can go to Green Bay and make $15,000 more. Some of our support staff are actually at the poverty level when you look that they only work 9 months a year. So they are taking other jobs as well. So the resources that we have do affect our ability to provide that equitable education. At a time when I grew up, local control was very much prevalent in a school district, where now we have less local control but more state and federal guidelines that are often unfunded, and I'm sure all of our organizations are in that. So what are some strategies that our schools have put in place? Again, it's really looking at how do we turn the tide from everybody's equal to equitable. So what does a child need in order for them to succeed? Most of us have adopted the state's multi-level equitable systems of support model, which looks at universal instruction, but then looks at putting in place student support teams when a student is not meeting success, and what kinds of interventions are going to be provided for that child. And it's not necessarily always a child who needs remediation. Sometimes it's a child who needs to be challenged. And if they aren't challenged in a school system, there can be other issues that arise. We've increased our early childhood efforts, but again, the high quality daycare is really critical because not all parents have their children in 4K or even in kindergarten. Our ELL services, we've increased our staffing and interpretation. We try to do as many things bilingual as we can in communications that we send out, starting to label things around the school. Significant professional development, but again, that has been curtailed by our resources, especially in understanding poverty, understanding cultural, so that we can eliminate our implicit biases that we have. So many times, even interacting with individuals in the community, it's not that they don't want to know, it's just that their experiences have not allowed them to have that personal conversation. Joe mentioned trauma-based schools. You know, I think at some point every child has a trauma of some kind in their life. It could be the death of a parent, a grandparent, a divorce or something, and then how do we become responsive as a community in assisting that child? The county used to have several years ago an alternative school. It was funded by the state, and then the state funding went away. At Southern Door, we still have made a commitment to an alternative school. It is within our high school. We often have children open enroll from other school districts, and it's usually about 14 or 15 students that are in there, and we find ways working with a number of the agencies to help kids get to graduation. Some of those kids are kids of color, some are not, and it's not just kids who don't care about school. One young lady 2 years ago had cancer. Did not think she could come back to school at all. And she was out for 2 years, and she came back into our SOAR program, got the individualized help that she needed, ended up eventually going to a program that the hospital does with us, which is a transitions program for at-risk kids. She ended up working in the sleep lab, and of course there was some downtime in the sleep lab as she was cleaning things, and the doctor there took her under his wing and talked with her about careers and what was she interested in. And when she walked across that stage for graduation, she was going to go be a medical tech, and she was going on to tech school. I don't know if that would have happened had she not had the experience she had, the mentorship that she had. And so I can't emphasize how important mentorship is. I'm going to go back just a little bit back to my Oshkosh days. The Sudanese are very tall. They come in at kindergarten looking like they're 5th graders, okay? The problem is people expect them to act like they're 5th graders when they're kindergarten. And I had the varsity basketball team, which was, doing really well, had one of our kids come to that level and said, "Where's he been all this time?" I said, "He's been here all that time. He just didn't have a family because of their being new to the country that could get him in a club league, that could get him the basketball shoes, that could get him to practices." They significantly changed the way that they worked with children growing up. Another one was a young man who was Hmong. It is very much part of the culture to dance if you are a male in the Hmong culture, but not necessarily to sing. He had a beautiful voice, but he wasn't able to access the youth choir or lessons or things like that. But music teachers took them under his wing, and when he got to high school, he really needed voice lessons in order to compete to go out east where he wanted to study. And a gentleman from the church came forward, so again, that faith-based community, and said, "Well, if you sing in my choir on Sunday mornings, I'll give you free lessons." So sometimes it's what we come forward with what one individual can do for a student, and his family was eternally grateful. It wasn't that they didn't want him to have that experience, it was just that they didn't have the means to do that. So we've been fortunate to also have some great partnerships. I'm sure Amy will talk about the mental health services that are now being provided in our county through collaboration, the YMCA, Big Brothers, Big Sisters, whether it's adults or it's our school-based mentoring. We have our emergency services and our justice system that are working with us with our youth. The hospital does a huge amount of wellness and kinds of things for our families, which is very important. But one thing that I think many people aren't aware of that they do, that is helping to change the conversation in the community, not only with kids in our schools, but also with the community, is they sponsor the LEAP project. And the LEAP project is it's getting organized right now, so for about 6 months, students from all over the county will come together as high schoolers, and they will identify a social issue that's here in Door County. And they will then work with facilitators who volunteer their time to put together a program with music and art and dance that gives their message of hope out to their peers and out to the community. And that's a huge sponsorship by the hospital in making that happen. So it is a way that we're able to take our youth and be able to impact some of those conversations with social issues. The Civility Project is another one, working with us in schools to really help kids and help families understand how do we treat each other, how do we appreciate diversity, how do we listen to each other. And then one that probably doesn't seem, or people may not make the connection, is when families host foreign exchange students. My first year at Southern Door, I happened to have a young lady who was graduating who was from Korea. And she was our one exchange student. I asked her how her experience was, and it was fine. She had a good, and I said, "What else? There has to be something else, something we could improve on." And she said it would just be nice if more people understood that Korea, Japan, and China are 3 different places. How many of our adults are like that unless you have those experiences? So if anyone wants to host an exchange student, we do not just take one. We have 5 this year. We sometimes have had the most of 8. It's just a great opportunity for our students and their families and our community to get to experience some cultural diversity without there necessarily being anything forced upon them, because the kids are experiencing, they see them in their co-curricular activities and in their schools. So what are some of the greatest challenges? Access to resources and personnel. I think we probably all can say that. Mental health services. The kind of barriers that are in the community that impact people who don't have kids in school also impact us. Affordable housing for families. winter jobs when they are working. You know, most of our Hispanic are probably connected to the farms, so they may have year-round jobs, but we also have some in the service industry. The impact of technology in Door County impacts people's ability to seek jobs, be able to access health care, be able to do a lot of things because of the internet. And when kids have internet at school and then they go home and there's none, that impacts their ability. Transportation is huge. Being able to get from one place to another. And then, of course, I also mentioned childcare. I happened to hear, and it was just perfect for this panel. I belong to the Wisconsin Rural Schools Association, and we had our conference this week. And Mara Teakin came in, and she's done research on ethnicity and race in rural schools. And her research is in the South, but there were some really important things that she shared. She said 51 million Americans live in rural communities, and about 80% of our schools in Wisconsin are rural communities. And as communities change and you have more of a mechanization of jobs, for instance, in the farming industry, schools are really the largest employer in many of these rural communities. But they're also the community gathering place, and it's where families come together. And it's where even if you have small numbers of people of color, if they are truly embraced as being part of the community and part of the family, they can feel valued and be able to contribute. Our current education policies really ask for us to be greater advocates for decision makers to craft policies that are going to help our rural communities. And despite all the current political discourse that's going on and all the competing interests that appear to threaten who we are as America, rural public schools are, and I was glad she used it, probably the only hope for communities to thrive. They are the soul of society for generations to come. And I often like to quote Tom Brokaw. He said, "There's a place in America to take a stand. It's public education. It's the underpinning of our cultural and our political system. It's the great common ground. Public education, after all, is the engine that moves us all as a society toward a common destiny. It is in public education that the American dream begins to take shape." I see wonderful things happening in our schools with our kids. I see what they're able to do. I read a beautiful writing sample yesterday by a 6th grader who talked about the difference between equality and equity, and I wish that we could just take that and publish that out for everybody to read. But I do think that Door County has a lot of great things going for it. We have some very strong community agencies that really work well with the schools. We have an economic development corporation that is very engaged with our schools about it, getting kids excited about careers and opportunities. And I think, you know, I always believe just takes a small group of people, like Margaret Mead says, to change the world. And if that's one by one, or if that's in a larger group, or if that's through policy, that's the way we do it. So, thank you.
Thanks, Patty. As said earlier, I'm Amy Kohnle. I'm the director of the United Way. I'm hoping to not cough too much. I apologize in advance for that. United Way's mission is to empower people to build better lives. The things that people think most of when they think of United Way is that we raise money and we give that money out to other organizations. That is what we do. However, we are very instrumental in assessing the needs of the community, finding out what's going on in our community, so that when those volunteers who are making those funding decisions on where those dollars will be invested, that they are making the best investment possible with those dollars. Sometimes, yes, the county shares dollars with us, and sometimes we share dollars with the county. And yes, sometimes we blame one another. So Erica, yes, you were right on that. Actually, I have to say we work very well together. Joe's staff and all of the nonprofits have a great working relationship here in Door County, which is something that's, I won't say very unique, but special for our community and really helps to serve as many people as possible. So I ran the numbers this morning, just as Joe ran the numbers this morning. And so in 2017, United Way invested dollars in 31 different nonprofit programs within our community. We asked those programs to report back to us an unduplicated client count. So we get an unduplicated count per each program. However, we call it a unit of service because somebody might go to Help of Door County. They might also be using a mentor at Big Brothers Big Sisters. They might also be getting assistance from DoorTran. So when we say we had about 12,000 units of service in 2017, we feel that was helping about 9,000 different individuals in our county. So based on the numbers that I pulled this morning, and I was glad to see they matched Erica's numbers, about 2.6% of Door County population is Hispanic. The programs that we funded in 2017 served 6.8% Hispanic. So of that about 12,000 units of service, almost 7% of those units of service went to people of Hispanic origin. And then for your Black, Asian, Native American, Pacific Islander, or multiple race, the Door County population within that non-Caucasian is about 2.8, and the services provided were about 8.8. So we can draw some conclusions, we can make some assumptions there, that some numbers are down, as Joe reported in his area. I did not take the time to do the longitudinal, but our Hispanic numbers continue to be up. So I think the organizations that clients are accessing through United Way dollars, they may not be as fearful of. And it also goes to possibly that wage piece of things, that folks are accessing services more through United Way funded partners who don't just fund low income, they're there for everyone, but that those numbers might be higher in the race area because of that economic piece. I'm gonna shift gears and talk about our Latinx, our Hispanic population for a minute. So one of the programs that we fund is Right on Door County. And one of the things that they started this year with some partial funding from United Way is a reading writing discussion group of Latinx students at Sturgeon Bay High School. And this group has a particular emphasis on native Spanish speakers or children of Spanish speaking parents. They had 14 students at their first session. They had their second session on Thursday. And interestingly, at that first session, they had more boys than girls, which Jared reports is very rare in any writing program of any age. He said there was a lot of discussion in that first week session on how the dominant culture, so Caucasian in this case, lumps all of these kids together as one under the heading of Latinx, or more ignorantly, Mexican. Those 14 students represented at least 7 different cultures, heritages, and customs. Though Spanish is a common language, there are significant variations, just as there are with the American English, the British English, Scottish English, and so on. There was also discussion that 3 of the students did not look Latinx, and others wouldn't have known that they were if they hadn't checked that box. There was a great deal of honesty in the discussion on both sides. These students are very proud of their heritage, however, they feel they aren't free to express it. The other thing that Right On did last year is partnered with Sturgeon Bay High School again to bring back the Clipper collection. So any of you that were students at Sturgeon Bay at one time, you know they used to put together this book of essays, poems featuring their students. That went away for a few years, and with a partnership with Right On and Dee Paulson, one of their board members, this came back. So a young lady named Yarit, she wrote a 2-page essay, and it is entitled Needed But Not Welcome. And she talks about what it was like to have her dad leave her family when they were still in, Amelia, I'm forgetting which country. Mexico. And then she talked about her mom immigrating to the United States and leaving her alone with other family members because her mom wanted to become established here. So I just want to read the very last 2 paragraphs of this. She is currently a junior at Sturgeon Bay, and she's 18 years old. We crossed the border at a point that not so long ago had belonged to Mexico and arrived in our new home in September of 2012. I was a very unwilling immigrant. I had just turned 12. I was traveling with a woman, her mother, who she barely knew, and neither of us spoke a word of English. After 1 week in Arizona and infinite hours of travel in a friend's car, we arrived in Wisconsin. 2 weeks later, I started attending middle school with kids younger than me, without language, friends, or a sense of self. I was a transplant, and something of a rare one. I walked the hallways and did not see myself in anyone's eyes. I felt like a deer among wolves, and this feeling continues to this day in some ways. The isolation of the immigrant is also self-imposed and thrust upon us by a country in which we are necessary but unwelcome guests. We are like oceans that touch but do not mix. My skin color, my accent, my deliberate stacking of jalapenos on the pseudo tacos we get in the cafeteria mark me as an other. In the beginning, the looks I received made me feel isolated, but eventually I realized that having myself as my best friend allowed me to discover talents I did not know I had, like my love for reading and writing. I think this happens to many immigrants, present and past, who arrive and set aside and in their isolation find power and strength that leads to contributions that enrich their new country. We learned the language and culture of our new home, not by choice, but by necessity, and in doing so, become part of something larger and very human. This is a quote, holders of the universal visa that God, from his consulate in the skies, issued to all of us at birth. And that quote was adapted from a song, a Guatemalan singer. And I just wanted to share that with you because, you know, coming from an 18-year-old who's been here since 2012, it's a very unique perspective. So I just wanted to close with that. Thank you.
Well, thank you all for giving us much more to think about regarding this topic and more to think about at the local level. Erica, I see you paging papers. Was there something you wanted to talk about in response to the panel?
I just had some thoughts.
You do it. You share those thoughts.
Okay.
And then we'll open it up for discussion.
Well, I think there was one thing that I wanted to touch on was, and I think everybody's sort of touching on, is that we often think we're focusing a lot now on the social determinants of health and thinking about how 40% of anybody's health outcomes, like their clinical health outcomes, actually comes from nothing related to health or health care, but rather your community, your neighborhood, the education, your employment status, and the physical environment, like how healthy your environment is. And so I was thinking about that as everybody was talking because it's very relevant in how we think about things. And I was, and I keep on going back to this idea that even though the populations are small, that it has an impact for everybody. I think one of the things that was striking is that we're struggling with whether it's school resources or mental health resources, or whether you're talking about the opioid crisis. And then simultaneously, we are having policies like the Badger Care waiver passed, and public benefits charge coming through. And the irony of all these things, in my opinion, my personal opinion, is that many of these policies are sold to us as being directed at people of color, coming from a racialized, sort of essentially racist lens. However, they're impacting white folks across the board, right? Disproportionately in many cases, folks of color, but like the Badger Care waiver whether it's sort of sold in sort of this thing about it being, you know, about folks of color that are somehow receiving our social benefits, when in fact it's the majority of the people that are actually receiving the social benefits are white folks, and they're the ones that are going to be those folks are going to be really hurt by circumstances like this. So it was just sort of thinking about how we're, you know, the data comes out in different ways. But fighting for your own community, regardless of who that community is made up of, actually has a ripple effect for fighting for other folks, and including communities of color across the state. So I think those policies all touch all the work that you're doing as well. So I just wanted to say that.
Great, thank you. I also know that we have representatives from a variety of groups here in the room today, too, who brought things to share, but also could take this time to talk about what's the piece that you're trying to tackle in regards to this issue, and give you that opportunity to share. We've got several. We'll just work our way back. Is that all right?
Where do you want us up there? Or
you can just, wherever it's comfortable to speak from.
I guess I go up there so I don't have my back to anybody. I don't have my back to anybody. It's kind of hard when you sit up. Hi, my name's Dr. Kathleen Torp, and I serve as the Executive Director of a community-based social justice nonprofit here in Door County called Just Door County. A gay couple walks into a hotel in Door County. The reservation is unexpectedly misplaced when they come walking through the door hand in hand. A Middle Eastern family referred to as terrorists by the store clerk who refuses to serve them. A Latina woman harassed for speaking Spanish with her mother. An African-American man who is asked to please find a white coworker by a white customer who refuses to let him handle her food. An international worker who was called "Hey you" all summer by her employer because her name was considered too hard to pronounce. A gentleman in a turban simply told by a restaurant, "We don't serve your kind here." Recent incidents in Door County of exclusion, of marginalization, and of outright bigotry, some as recent as last week. Just a few of the many, many we are told by the people who experienced them or the bystanders who witnessed them. In response to the question of how do you start conversations, how do you reach people, that's the primary thing that we do at Just Door County. We facilitate some of those hard conversations, all the way down from toddlers and preschoolers to school students, college students, seniors, community members, everyone that we can get to listen to us, to talk about what is happening kind of under the surface. Are these incidents statistically significant? Maybe not, but we know numbers don't tell everything, and we know that they are significant to the people who are here, who live, work, and visit here. And that was something that our data really didn't talk about, is the many, many people of color who are here as visitors. And that skews our numbers dramatically for half the year, as well as our international workers and other workers. And so we have those conversations, we collaborate, we do exhibits, we do workshops, staff training for organizations, fellow nonprofits, as well as in congregations and for businesses up here. And I invite you to learn more about us, to join us. We have some materials, an email list, to sign up to learn about future events, including a bystander intervention workshop. So if you see something, you are empowered with tools to know what to say, to what to do. Because we want to change these stories. We want to end the stories, we want to write some new ones. And that includes everything from creating better reporting forms to capture these stories, to empower people to feel safe to tell the stories, and to change the images we have at Door County. So when we open our Key to the Doors, our Go Guides, all our tourist magazines, we see faces that are truly representative of what we want Door County to be. Not just what the numbers say it is now, but where we want it to be. Thank you.
Thank you very much. Holly.
I mean, really, that is incredible, you know, to hear that kind of thing. You know, I came here 20 years ago from Virginia, and I feel that I've been discriminated against in a lot of ways. I've been called an N-lover. I've been given Confederate flags. I've been given a book of Remus poetry and as his book. I mean, I've had a lot of things done to me over the 20 years I've been here. And one of the big things is being told how racist the Southerners are. And I think, are you kidding me? You need to take a look around at the way we treat people here. It's unbelievable. I think, and I said when I was on the county board, you need to get a bus and take a ride off of 42 and 57 and see what Joe Krebsbach does every day of his life with his staff. There are people here that live in filth and squalor, who do not have windows in their homes, who do not have adequate heating, who do not have adequate flooring, and that continues to go on. I do not, for the life of me, understand how just as a person we can allow those things to go on here. I've been grateful. I had a gentleman who gave us a big money thing that was incredible, that I helped a lot of people with up here who needed just basic things, a roof on their house, new windows put in, things that the county obviously doesn't have money for. So there are people who are willing to do that, and that's their place in all of this, is that they've got the dollar. But there are those of us who can make a big difference in how we treat each other. And I think if you do get off of the 4257, you take a ride around here and look at some of these places where these people live in, it's incredible how they're treated. Whether, you know, and one of the other things that amazes me here is the remarks about being Polish or Belgian or all, you know, all these things that I'm amazed at, that we talk about those kinds of things in reference to how smart somebody might be that you're going to take care of. I mean, it amazes me. I don't understand it at all. And I'd like to see somehow we come together, those who have money and can help, and those of us who can give of our time, volunteer for whatever it is. Or if you see somebody's got a disparity, then call Joe and tell him that you need his help. I mean, really, if I hadn't had social services and still had not had that department, they are hugely important here. And I also know from having sat on the county board that social services should be giving a huge budget and have no argument about how much money that they need, because they provide for these kids. There are children here that are suffering. There are old people who are suffering, people in between. I can testify to that. I can take you now down the road and show you some living situations you probably would not believe. And it's just wrong. And what you're saying, oh my gosh, I can't believe these people come here and they're talked to like that. I mean, who would? I can't believe. I mean, really. I just don't understand. So the bigotry is everywhere. It's not just the South. And I think, what did somebody tell me? Was it Mark Twain or Faulkner? Said the South loves the person and the North loves the group. And I think that's very true. That's kind of how we look at it. So that's my spiel on this. I've been kind of rabid about it since I've been here.
Thank you, Holly. Thank you. Others? Susan?
Yeah, hi, Susan McIntosh. I'm a league member. And I have just a couple of questions that I know we're not going to be able to answer in, 15 minutes, but that relates completely to what we've been talking about. And the first one is, I wonder what is the evidence that Door County wants to expand its cultural and ethnic foundation fundamentally, and if so, is Door County really, are we equipped economically, are we equipped socially, are we equipped to embrace a broader ethnic base? Those are awfully big questions, but I wonder too, instead of the process of how thinking influences your feeling, and that influences how you act, if we start from the opposite and we act, and that will influence our feeling, and that will then ultimately influence and change how we think. Where is Door County in terms of a living wage, becoming a living wage county? Is that something that is so pie in the sky that it's just silly to, it's fantasy or not? And I don't have an answer to that, but those are my questions, so thank you.
Does anyone on the panel want to respond, or anyone in the room want to respond to any of these comments? Lots for us to think about. Kathy?
Susan, this is a question I've gotten before. A couple things. Your question is, do we want to broaden our base? Well, in a sense, one, we may have no choice. But as far as intention, if you go back to the Discuss Door County sessions that were done several years ago, among seniors, one of the top things that they cited that they wanted to see in Door County was a more diverse community. Racially, ethnically, they wanted to see that. And if you also talk to younger folks, and younger pretty broadly up in Door County, 40 and under, especially many who have come back to raise families or who are transplants, that is one of the top things that they will cite over and over again that is kind of hinges on their decision whether they stay or not. If they want to raise their children in diverse communities, and that was something that Jim said that he looked at with his son. We have 5 children, and they're all young adults now, and 4 of them are children of color, or adults of color. And that was something that is very important, is having a diverse community. So I think some of that intention is there. The question is more, are we equipped to do that? And that's a long process, but there needs to be intention and commitment.
Comments, questions? Carol?
I noticed a couple of people have used the word transplant. And like I said earlier, I came here from Detroit, and that's what I was called, a transplant. And I used to also work in the medical field, and a transplant is very important. You know, an organ transplant is very important. Okay, I'm not that important, okay? But I notice in Door County, because when I moved from my small town in Upper Michigan to Detroit, I wasn't called a transplant to Detroit. I was welcomed there with open arms. When I moved here, I was called a transplant and not particularly welcomed. So I understand the use of the word. I've been called it. I wish we could get away from that too. I mean, we're all just people, and we're all equal.
Amy?
Susan, one of your other questions was about living wage. As some of you in the room know, United Way is part of the ALICE project, Asset Limited Income Constrained Employed. And that is something we spoke about through this speaker series last year, so thank you again to the League for hosting that. Unfortunately, our numbers of people who are struggling, whether within poverty or within that ALICE threshold, that group that we say is unable to invest in savings, unable to be prepared for those life emergencies, continues to grow here in Door County. Between 2014 and 2016, the percent went up from 29% to 32% of our population is struggling. So unfortunately, that living wage issue is part of it. Our unemployment rate is the lowest it's been a long time in Door County, but what are those wages? How many of those people are working 2.5 jobs to make ends meet? So that's another conversation, Susan, but just wanted to put that out there.
I'm going to jump back to the idea of, are we ready? Because I think we could debate that for days. And I would say my first reaction when you asked the question was, I don't believe that we are. That's more anecdotal maybe on my side of working with minority individuals who talk about their experiences here. Because the things that you presented regarding the discrimination that happens here, we hear that, and it's significant, and it's uncomfortable. And why would I want to subject myself to that and live here and move my family here if I'm going to have to deal with that? So I would say, based on the fact that everybody that's sitting in this room is sitting in this room, this group is ready. But I'm not sure that as a whole, or even as 50%, I would say we're ready. And again, I think that's where, you know, and I have a tendency to stay very neutral about things because I need to work with lots of populations to get the resources that we have for human services to do the work that we do. But that being said, I would go back to the conversation about just how we treat one another and how we think about people in general, whether they're of color or their sexual orientation or their economic status. Because I don't believe, even in our small community, that we treat people who are different fairly the majority of the time. So, and again, I say we could debate that back and forth for a long time. There's probably lots of opinions in this room about that, but I really have concern about whether or not we are.
Here, and then I'll come back there next.
Erica was talking about how do you start to break down some of the barriers to, you know, to having some of these conversations. And something you said, Joe, struck me that, you're doing this work, Jim, you're doing this work, but you don't necessarily do it. We don't have enough of a diverse population to make it a big piece of what you do. But imagine the struggles that you're having, and those same struggles are happening in Milwaukee, in Madison, in Dane County, except they're doing it with an overlay of, racial bias, with an overlay of, driving while black and ending up in prison, taking those people out of the community. And so maybe one way to start breaking down those walls is to do things like seminars where we're talking about those issues and how they cross, bring people from Milwaukee or Madison up here, with you on a panel, to talk about the common issues and how we can all address those together, because that's one way to start breaking down those walls in a community where it's, the statistics don't bear that out.
I was just going to say, to add on to it, instead of coming from the deficit model, right, in thinking about the future, right? I mean, people can, dig in deeper on being unwelcoming, but it's not going to benefit the economy. How many people are you going to lose out from a brain drain or creatively speaking or whatever you have? And then with rural communities, there's got to be a plan. We have to start thinking about how, when the economy is changing, what is the future plan for these economies in these regions? And part of that has to be looking to the future. You even think about, everybody is super, always talking about Silicon Valley and California and whatever, and they boom so fast that they didn't plan from a housing perspective, a transportation perspective, none of these things. I think there's some opportunity and some assets to think about, how do we plan for that going forward? How are we thinking about the changes, even if they're not here or it's not right in front of us today or maybe in 2 years? But what can we learn and do differently to sort of capture all the positives and there are thousands of them, a myriad of positives of having a diverse, more inclusive community. So that in and of itself, you begin to sell yourself as the potential for that, then you get a completely different economy and a completely different future than if you're always behind the 8 ball trying to catch up to what the thinking is around these sort of things. So, thank you.
I think the other thing that's important with that is we keep hearing how Door County is getting grayer and grayer, because people come up here, they have a great experience, they retire up here, but we also heard, like just last week with the manufacturing days, about the shortage of people to fill the jobs that we have. And if we're going to be a thriving community, we need to have young families and individuals moving up to our community. And that means, I mean, in some senses, we have a hard time holding on to our millennials because of the experiences that they have. So I think we really do need to be looking at how do we, from each of our perspectives, start making our community a more welcoming place. And again, I think you were spot on when you said it starts one-to-one, and it starts with your interactions, because you can't control what others do, but we can control what we do and how we impact in the model that we set. And I think that that's important for us to look at. There's definitely the needs that are occurring right now, but we also have to look forward to that future, or we're not going to be a thriving community.
Hi, my name is Peggy Sankey. I'm with a group called Literacy Door County, as are 6 or 7 other people here. We're either board members or tutors or both. And what we do is we mostly tutor English to immigrants, but we also will help with GED preparation for anyone, but we tutor adults only. We provide our tutoring one-on-one, one tutor, one student, or Amelia also offers a class one night a week that is a group class. It ended up last year, where she said had 10 or 11 students in the class because we did not have enough tutors. We train our tutors. We are under the auspices of Pro-Literacy and Wisconsin Literacy. And a little few statistics about us is, while most of our students are Latinx, I like that. They are not all Mexican. We have served students from 11 different countries. And after the storm in Puerto Rico, we have quite a few Puerto Ricans here also. Since 2015, we've served between 50 and 60 students. We have right now approximately 30 working pairs, 30 tutors, 30 students. We've provided over 2,050 hours of tutoring since we began. Now the truth is most of our students do not become totally fluent in English. They're adults, they work, they have families. Their children are the ones that will become fluent. But we do have a few higher level students who are interested in possibly going on to school. So anyway, that's what this group is doing, and loving every minute of it. Oh, as far as people who were born here, that is a part of the community we have not had success breaking into yet. But yes, other literacy groups.
Helen helped me in the agency because I go in and ask them to read the contract.
Right.
And find out they could not read.
Right. Well, we're available to help tutor those people if you find anybody who will come. Because the truth, good. The truth is that immigrants. Right.
Back years ago.
Right.
A lot of things I think weren't really, if you find things when you went into a home, it was very different from me coming to the emergency room and going into a person's home. It's an eye-opening experience.
Unless you're going to give a speech,
Oh, right. Well, immigrants are anxious to learn to improve their English and learn to read. The population you're talking about is very hard to reach because they're not proud of where they've ended up. But we're available to help tutor them too.
I just wanted to say, I know that you use the word tutors and that's what you are, but what I hear from the people being tutored is that you are mentors. They feel that it's bigger and more helpful than just the language piece. So that's good.
Okay, I wanted to address a couple of comments I heard here. My name is Amelia Canillo, and I'm a teacher and a college professor. I teach Spanish. I'm Portuguese originally, and I'm over here, as I like to tell my students, teaching the language of the enemy. Spain has a lot to be blamed for as far as my history is concerned. So I would like to address the Can Door County afford diversity? I think that ship has sailed, don't you think? You know, I think that, you know, you talked about the Belgians, the Polish, you know, that's diversity in and of itself, I think. So I think that, you know, if we just stick to the idea that diversity is a color, then we're missing something very important because, you know, it is not color. And what we have to do in order to accept all these diverse people, I mean, we are all, as human beings, great collectors of mistakes. We pile them up. We make our own and we collect other people's. So I could tell you, I could top you any day on wrongs that have been done to me. But really, is that the way to go? My feeling is that, you know, what Erica said, find your lane and work from the positive. So my lane is that as an immigrant, I came here from Portugal, a European country, and was immediately classified as a minority, as a color. I was not used to that, but I revel in it now. I am racially ambiguous and I love it because it gives me an opportunity to, you know, set you straight. Right? It's just a lovely thing for a Southern European woman to do. Not just a Southern lady, but a Southern European woman can do that too. So this is what I did to find my lane. I became a teacher. I volunteer with two very worthwhile organizations in the county, Legal Aid of Door County, which tries to bring justice and the law to those who are below the poverty level. And we do a great job defending women, minorities, everybody that walks through our door. And I joined Literacy Door County because I thought that the best way to rise up is to read, is to become educated. And then the thing that I've learned in the 30 years or so that I've lived in this country is that there are parallel universes in this country. One where race does not exist and one where it does. And so people walk side by side, not realizing who's next to them, who's sitting next to them. Carlsville, the barrio is just down the street from here. There's a trailer court there filled with the parents and children, you know, that I educate in my school. Some of the children that Amy mentioned, you know, one of the girls that wrote, you know, Yaretu wrote that lovely essay, which I translated and edited with her. It was a wonderful collaborative effort. Lives just down the street, you know, so there's a lot of, I mean, we sort of walk around with blinds on, don't we? And so I just wanted to say, in my lane, you know, the lane that I'm traveling, I see a lot. And I would encourage you to join that lane. You know, Literacy Door County, we need tutors that can reach out to the groups that are usually don't have a voice, like the, you know, uneducated white folks, you know. Legal aid, we need money, you know. So you got a pocketbook, you know, got a checkbook, you know. There's many ways that you can participate. Amy right there, they'll be a good place to start because they do help everybody. And okay, that's my 2 cents. I have more, but I'll stop here.
Everybody's 2 cents counts here, and it's glad to have so many people share their thoughts. Others? Oh, it is? Oh, it is! I hadn't looked at my watch recently, so. Well, I'm sure there'll be some movement and lingering around. You really could have more to eat before you leave. League of Women Voters always tends to have a lot of food. Helen, thanks for getting it all set up over there with your little team. And through having more food, you can continue with conversations about this. This wasn't intended to be a session where we came up with a determined action piece. But I like what Erica has challenged us to do, and as others have repeated, and that is finding our lane where we can do something. And maybe that's something that each one of us can leave today with, is identifying that lane where we could make a positive impact. So again, I thank our panelists, I thank Erica, and we thank all of you for being part of this discussion. Have a great Saturday.